Senator Hudson. Good morning, Chairman Langford, Chairman Jordan, and members of the committee. Thank you for inviting me to speak with you today. My name is Matt Hudson, and I'm honored to represent District 80 in the Florida House of Representatives. I also chair the Florida House Health Appropriations Subcommittee, serve as Vice Chair of the Florida House Select Committee on PPACA, and co-chair of the National Conference of State Legislatures Health Committee. I'm also a Florida realtor. Remember when you bought your first home? You saved money, found a home you liked. And then what if your realtor had handed you a contract and you had to review it and 3 of the pages were blank? And then when you questioned it, they said, "Trust me." I'm positive none of you would have invested your money that way. I'm positive that the citizens of Florida expect their government to make well-informed decisions, not based on federal promises like, "Trust me." But that's exactly what the ACA has forced us to do. What we do know doesn't look very good. The ACA will make our health workforce shortage even worse and has led to skyrocketing premiums. It has kept states uninformed, put consumers' privacy at risk through the insurance exchanges. And its Medicaid expansions threaten patients' health and taxpayers' bottom line. The ACA will make our health workforce shortage even worse. By 2020, we will have a national shortage of more than 90,000 physicians and 1.2 million nurses. In Florida, about 13% of our physician workforce is retiring in the next 5 years. And we are currently already short 753 doctors in our 248 primary care crisis areas. A massive influx of government-subsidized healthcare recipients because of the ACA's insurance exchanges and Medicaid expansions will make things much worse. Because of the ACA, patients will face even longer wait times and worse access to specialty care. Costs will obviously spike as the demand for limited healthcare services will dramatically increase. The ACA will drive patients' premiums higher. We were promised the ACA would let us keep the plan we like and the doctors we trust. But the premium increases resulting from the web of new regulations and mandates make that an empty promise for millions of Floridians. The Florida Office of Insurance Regulation projects that our small group and individual market premiums will rise an average of between 5 and 40%. Will these folks have to choose between prohibitively high premiums, inferior government-run health care, or no coverage at all? Where's the promise in that? Washington isn't providing answers about insurance exchanges or protecting citizens' privacy. As Florida weighed whether the state or the federal government would build a state-based exchange, we had questions that needed answering. These questions were included in a 3-page November 2012 letter from our House Speaker and our Senate President to HHS. They did not respond until January, after our exchange decision deadline. And the response was just 3 brief paragraphs that did not answer any of our questions. Based on the final HHS rules for federally facilitated exchanges, Florida made the right decision in rejecting a state-based exchange. Still, the timeline and HHS's non-cooperation made an informed decision process impossible. What we did know is that the exchange applicants will have to hand over Social Security numbers, birth dates, employment information, tax returns, and much more. All the information needed for identity theft. And we took action. Florida passed a law that required the registration of exchange navigators, which included background screenings, disqualifications for certain crimes, and penalties for improper actions. Medicaid expansion is wrong for patients and taxpayers. Medicaid is already a problem across the nation. Access is limited and outcomes are poor. The only randomized controlled trial of Medicaid ever conducted found no improvements in health when compared to the uninsured. Still, the federal government continues to push Medicaid expansion in Florida. We rejected a Medicaid expansion to add another 1 million people to the Medicaid rolls because we knew access problems would get much worse. And it's been difficult to estimate true costs of expansion. In Florida, official cost estimates for Medicaid expansion range from less than $30 billion over a 10-year period to nearly $55 billion. And then as we learn more about expansion, cost estimates for Florida portion went from $1.4 billion to $3.5 billion. And even these estimates assume that the federal government will be able to keep its funding promises despite carrying $17 trillion in debt? States deserve answers to these questions. Washington is notorious for passing laws and leaving states to figure out how to make them work. In the case of the ACA, we deserve to have our concerns heard. Thank you, members of the committee, for giving me the opportunity to talk to you today, and I look forward to your questions.
Thank you. Thank you to all.